Hi.
Thank you so much for hanging out with us today.
Yeah, thanks for having me. Excited to be here.
Yeah, we're really excited about this conversation. Yes. So pelvic floor is just so important.
Yeah.
And you hear about it all the time, but honestly, I'm like, what exactly is it? So I'm glad we're talking about it. So what exactly is the pelvic floor and why is it important for women's health?
Yeah, I think that's a really great question. So a lot of people will ask that. They're like, what even is that area? So it's actually a group of muscles and they run from kind of your pubic bone all the way back to your tailbone. And you can think of it kind of like a hammock. And those muscles, basically what they do, they help to support. So they support your bladder, all of your organs. Yeah. They help with stability of your pelvis. They help with sexual function, childbirth, obviously, and then also with continence, so not pooping or peeing your pants, right?
I would laugh because every time I sneeze, I have to stop everything and squeeze my legs and be like, don't move.
Yes.
Oh. How do the pelvic floor muscles work and other parts of our body, like the core and bladder?
Yeah, it's a great question. So the pelvic floor does not function in isolation. So the pelvic floor has to work with your core, with your diaphragm, which is how you breathe, and also your back muscles. So it kind of creates this canister. So we call this kind of pressurized core canister, with the pelvic floor kind of being the bottom of it. Okay. So these things need to function together. So pressure, as if you think of it like a pressurized can, think of like a can of soda, a can of beer, wherever you shotgun it or open the top, pressure is going to go out that hole, right? Mm-hmm. So when we think about, like you said, sneezing, coughing, and you leak a little. Yeah. Well, that's because the path of least resistance might be through your urethra where you pee, versus some other people may notice, they have a hernia or something along those lines, or diastasis. That's maybe their area of least resistance, their weaker spot is their core. So all these things kind of play together in this pressurized canister where you have to have all the layers to work. Otherwise, you're going to have a leak somewhere.
Okay. So interesting.
And what is diastasis?
Yeah, so diastasis, it's super common and actually very normal and expected to have during pregnancy. Okay. So it's kind of a core separation. So you have your rectus abdominis, your six-pack ab muscles that I haven't seen in I don't know how long, a decade. But the six-pack core ab muscles basically start to kind of stretch a little bit further apart and they separate. And when they stay separated and we don't have good core contraction underneath, that's when we run into problems.
Oh, okay. No, it probably does sound like it would be common.
So if you feel this urge to pee, would you say like take a deep breath and use your core muscles as well? Or, people try to hold it. But...
No, I hear you. So I think it depends. It's very nuanced, right? So when it comes to, let's say you get this urge to pee, my first question to my patients is, how long has it been since you went pee last? Okay. Because if it's been, right? If it's been like 4 hours, 3 to 4 hours, great. Walk calmly to the bathroom and go pee. Like that's a perfect amount of time. If it's anything less than that, we're thinking like 2 hours, 1 hour, 30 minutes, anything like that, probably don't, right? Take a deep breath. We know that your nervous system and your diaphragm helps to down-regulate your pelvic floor and that urge to pee. So if you can take a deep breath, maybe do a couple of Kegels. This is where Kegels can play a role, which we can totally talk about more. And that will help to calm down that urge. Okay. And then really ask yourself, do I really need to go pee? Or am I just in case peeing?
Yeah.
Because that's super common.
For sure.
I do the just in
Sometimes I forget. Did I pee recently?
Right. So some people, they'll like space out their pee too much. Like, I know yesterday we're setting up our second clinic right now. Yay. And thank you. We had all of this stuff to put together. And I think I got like 6 hours into the day and I was like, have I gone to the bathroom yet? Which is a problem, right? Yeah. So that's the thing. It exists on both ends of the spectrum. You can pee too often and you can delay peeing too much and wait too much, thinking like nurses, teachers, doctors, lawyers, people that are like, I literally can't take a break to go to the bathroom. They train their bladder. Yeah. Which we don't want to do.
Right. Oh, scary.
Yeah.
What are some early signs of weak pelvic floor and that women might ignore or dismiss?
Yeah, absolutely. So big things. The main one people think about, right, is urinary leakage. So
Right.
peeing your pants when you don't want to. I don't think anyone ever really wants to.
Yeah, but I feel like we just laugh about it and think that's just normal.
Exactly.
Yeah.
Exactly. Well, it's because that's what our moms told us.
Yeah.
Right? That's what our grandmas told us because they peed their pants. Therefore, we have to pee our pants, which I'm just going to tell you now that's not true. Okay. There are so many solutions. But so peeing your pants, that's definitely a big one, right?
Mm-hmm.
Leakage. Not being able to completely empty your bladder. That's another issue. Constipation. Hemorrhoids, if you feel pressure in your pelvic floor, like you feel like your organs are falling out, that is a thing. I'm trying to think of some other things that are like big ones. Definitely if you feel pain with intercourse. So intercourse, speculum exams, anything that has to go inside, if it hurts, there's an issue that can be fixed.
How can you tell if you haven't emptied your bladder completely?
So the people that sometimes they still feel like fullness, or when they go to the bathroom, they just have a really hard time getting a full void out. Like they feel like there's still more in there, or maybe they just peed a little and they're like, man, I really felt like I had to pee a lot, but it was only like a couple of seconds. Or if they have to pee again really soon and there's still a lot of pee, they may be having a hard time relaxing, because you have to relax your pelvic floor muscles in order for your bladder to actually fully empty.
Oh, wow.
And that can be not just the bladder, it could also be your bowels,
Correct. Yes, absolutely. Most of the things that we talk about with urine totally applies to, feces. 100%.
Because it's all the pelvic floor.
Absolutely.
I need to start keeping a pee journal.
So we actually do that. We have some clients. It's a useful tool for a short period of time.
Okay.
Nobody needs to keep I think you're talking about nutrition, right?
Right.
Food diaries are so helpful.
Right.
But maybe not every day, and maybe not for your entire life.
Right.
Right. There's seasons that you can do it. So yeah, we totally, if patients are having issues with, peeing too much or not peeing enough or issues like that, or even constipation stuff, we're going to have them keep a journal of it, maybe for a couple of days. Okay. We're going to look for patterns. Yeah. And then we'll change some behavioral things. And then we'll look for patterns again. And then, pretty quickly, we don't need to keep track of it anymore. Yeah. You can just live your life.
Yeah. I feel like I'm always in the restroom. Like I'm always heading there. I just came from there.
Right.
Is pelvic floor dysfunction different? And what is that and what causes pelvic floor dysfunction?
So pelvic floor dysfunction is really all the things we just talked about.
Right.
So it's just pelvic floor dysfunction is like a catch-all umbrella term for all of the diagnoses or symptoms or things that happen kind of under the surface.
Okay. Mm-hmm. Oh, wow.
Yeah.
What is the major causes of the dysfunction?
So the main one that everybody thinks of right off the bat is pregnancy, postpartum, because those are the ones you're like, okay, you had a baby and now you're peeing your pants, right? Those go hand in hand. Yeah. But you'd be so surprised. I would say probably at least 40, maybe 50% of our practice is people who have never had a baby or men.
Oh yeah. I learned recently, my coworker, when I was working on Lackland, because I was like, oh, hey, I'm going to sneeze, just the issue. Yeah. And he's like, that happens to men too.
It does.
I had no idea.
Yeah, I didn't know that either.
Yes. So we're one of the few pelvic floor clinics in San Antonio that treat men. We have 4 specialists on staff that do that, which is crazy. So pregnancy, postpartum, definitely a big one. Honestly, as people age, so think menopause, perimenopause, anything around that stage, there's a lot of people who come in through that door. Any history of surgeries, that can definitely predispose you, especially abdominal surgeries or pelvic surgeries can really set you up for, if you already had a little dysfunction, it can make it, a little bit worse. And then constipation, I keep talking about constipation, but chronic straining or pushing, right, it has to come out somewhere.
Right.
And that pressure is going to go down into your pelvic floor.
Oh, wow.
Yeah.
So can you actually see or feel your pelvic floor weak or tight?
So you can't really see it.
Right.
Right. It's definitely not a visual thing.
Right.
It's more of a body awareness, maybe a proprioception kind of thing, where you're aware of your pelvic floor, but that's really where the internal pelvic floor exam that we do within our practice can really pinpoint, is it weak? Is it tight? By testing those muscles, right? Because the pelvic floor is muscles. Just like we can check to see if your upper neck muscles are really tight or your hamstrings are really tight. We can do the same thing for your pelvic floor.
What does that exam look like?
I was going to ask the same question.
Yes. So let me just start off with it is not your typical OB exam. So there are no stirrups. There's no super bright lights. Nobody is shining a spotlight on your hoo-ha. All right. It is nothing like that. You're almost fully covered. It's really, there's a lot of consent that goes into it. Right. And we only go, really along with how the patient is feeling and what they would like. Yeah. So what that involves is it's one finger, gloves, a little bit of lube inserted vaginally. Okay, and we're able to actually assess the different muscles within the pelvic muscles, right, as you're in there. Right. And we'll check to see, are they tight? Does that cause any of your pain? We'll have you do Kegels, have you do some contractions, have you cough, sneeze, laugh. So we can see, what are you doing? What are the muscles actually doing during those functional activities? And then we take crying, right? Yeah. We take it one step further for some of our clients that maybe they're having leakage with running or something a little bit more higher activity than just coughing. And we'll actually do that exam in standing. So we'll have you toga a sheet and we'll check. And then we can see what's actually happening with gravity.
Oh, wow. Yeah. I was telling Cindy I was trying to play basketball because that's what I grew up playing. I love basketball. Yeah. A couple years ago, and it was not good. Every time I jumped, it was just it was sad. I want to play in a granny basketball league, but I don't think I'm ready.
Yeah, we just need to do an assessment. We can figure it out.
How do hormones play a role in this, and estrogen levels and stuff like that with women?
Yeah, so hormones are everything when it comes to the pelvic floor. Your pelvic floor loves estrogen. Right. And guess what happens when you're in menopause, when you're in perimenopause, or when you're lactating? Estrogen tanks, right? It goes so far down. And when it goes down, that means our pelvic floor isn't getting it. And so when it's not getting it, it's going to actually get a little bit weaker. The tissues are going to become more frail. So you're going to be more likely to have little micro tears. You could bleed a little bit more. The tissues become less plump. And that can also lead to increased UTIs, increased dryness, all those kind of things. So a lot of women, as they approach menopause, will be like, I don't have any pelvic floor symptoms. But then they hit menopause, estrogen drops, all of a sudden they have a prolapse, they have recurrent UTIs, they have pain with intercourse, all these things. And guess what? They just need some estrogen. So the cool thing is that the black box label warning on estrogen was just removed last week.
Yeah, I just saw that.
Right?
Yeah.
Amazing. Goodness. So talk to your doctor.
Yeah.
Get some estrogen. All right. Topical estrogen is gold.
Yeah.
Yeah.
For your pelvic floor. I'm postmenopause. I'm also on hormone therapy. So I do the little patches. And we had a Dr. Hope. Was on here, and she was talking about how important estrogen is. And almost every conversation we've had about women's bodies includes estrogen.
Yes.
It's so important.
Well, we have estrogen receptors all over our body. We have them in our brain, which is why women, when they hit menopause, will experience brain fog, fatigue, all these things, mood issues. There's literally receptors all over.
Can you tell on your own if you have prolapse, or is it something that only you can let us know, or the doctor?
I mean, if you have a mirror or a phone camera, you could definitely check.
Okay, so what would that be?
Yeah, absolutely. So you can lay on your back if you'd like, or you can stand, put a mirror or a camera between your legs, look to see, obviously in the reflection, if as you cough or you bear down really hard, do you see kind of a bulging through your vaginal opening? So prolapse is basically the descent of your bladder, or maybe a wall of between your near, oh my goodness, what am I saying? So your bladder, your uterus, your rectum, not the actual organs themselves, but just more the walls that support them start to kind of come downwards.
Oh, that sounds
so it's like a hemorrhoid.
Kind of. Yeah, it's kind of like a hemorrhoid, kind of like more like a hernia. Yeah, okay. More like a hernia. Mm-hmm.
Wow.
Yeah. And it's really, a lot of people, unfortunately, it's really scary.
It is.
It sounds scary.
Yeah. So I have a prolapse. That's what got me into pelvic health in the first place.
Oh, okay.
Because I went to my doctor and they were like, well, you have a prolapse. And I was like, okay. And what, can I keep lifting weights? And they're like, no, absolutely not. And I was like,
oh no.
What?
Yeah.
There was no way that could be the reality.
Yeah.
And that's just not true. Oh, there's so many things that people can do to be able to lift, to be able to run and jump and whatever after a prolapse diagnosis. But there's so much fear and misinformation around it.
You can still have children after that. Everything.
Absolutely.
Yeah.
Absolutely. There's no research that says that a prolapse in your first pregnancy leads to a worse prolapse in your second pregnancy.
Okay.
So you don't have to automatically get a C-section. Still have the vaginal birth you want. Okay. Totally fine.
Yeah. That's good. Good information.
Yeah.
So scary.
There's so much fear around it.
Yeah, I bet.
I felt it 100%.
Oh, wow.
Yeah.
So let's talk about urinary leakage just a little bit more.
Yeah.
Is this normal, or is this something that we need to get checked out, and how can it be treated?
Yeah, it's definitely not normal. Super common.
Yeah.
Urinary leakage is very common, but it's definitely not normal. So things that you should do if you're experiencing leakage, first thing you should do is go see a pelvic floor physical therapist. That could be us, that could be another clinic, but go see someone. The nice thing is that in Texas, at least, you can just go see a physical therapist. You don't have to talk to your doctor first.
Yeah.
You don't have to do any of that. You can just go straight to them. You don't need a referral. Just go straight through, which is awesome.
Even with TRICARE?
Even with TRICARE.
So I can just go see you and then you bill TRICARE?
Correct.
I had no idea.
Oh my gosh.
Yeah.
I'm so happy right now.
Yes.
Because that whole process of going through your PCM and getting the referral, also, although my PCM is amazing.
That's great.
So I think I could just do it by email maybe, and he'd have a few questions. But that whole process is usually such a hassle.
It is, yeah. TRICARE Prime versus TRICARE Select. There's some nuance there, but we can definitely talk about that offline. But yeah, you don't need a referral in Texas unless your insurance requires it, right? There are some insurances that want you to jump through 10 million hoops to get what you need.
Right.
But yeah, leakage is not normal. First step, go see a pelvic floor physical therapist and get an assessment, because the problem is a lot of people, like I remember when I went and talked to my OB the first time because I was having leakage, they were like, okay, we'll just do some Kegels. I got a piece of paper and was told, do more Kegels, which didn't actually help me. It made me worse.
Mm.
Yeah.
Oh, because I thought that was the answer. I thought Kegels was the answer for that.
Maybe for 50% of women.
Okay.
Gotcha.
Oh, good to know. So it's really vital that you get it checked out.
Right.
Especially to figure out what's best for you.
Right. Yeah. Because if your pelvic floor is too tight, doing more Kegels is actually going to make it worse. I want you to think about your jaw muscles, right? So with your jaw, if you clench a lot and they're already really sore and you keep clenching and you clench more and you clench more and you clench more, is your jaw going to feel better?
No.
Probably not. Same thing goes for your pelvic floor. Your pelvic floor and your jaw are actually really similar. So if you are continually contracting and contracting and contracting and contracting, and your pelvic floor was already tight, it's just going to get tighter. And not in a good way, right?
Yeah.
Not in a husband stitch way or anything that would be wonderful. In a painful, uncomfortable way.
Oh my goodness.
So for women that need Kegels, of course, you recommend that. But if they are tight, what do you recommend for them? Dilators, or how's that?
So dilators could play a role. So dilators are basically, they're a medical tool that you insert vaginally to help kind of just get your vaginal area more lengthened, more room, less sensitive basically. So, or there is just down training, things where we can get the muscles to stretch out a little bit, things to get them to relax. Think about a tight muscle in your neck. What would you do with that? We're going to probably stretch it. We might do a little bit of massage on it, not in a weird way, but just get those muscles to chill.
Yeah.
There's other things that we can do, right? Looking at what is your stress like? What's your nervous system like? How are you carrying your tension? Because if you have a lot of tension here and here, I bet you $10 million that your pelvic floor is tension too.
Oh my God, I have problems then. Because everything up here is just
all of it.
Yeah.
Yep.
Oh, so I'm so glad we talked about that, because I honestly just thought that leakage was just a part of getting older. It's just a normal part of being a woman, being 50 or 40 plus, 30 plus, whatever, but it doesn't matter. You should always get it checked out.
Absolutely. Incontinence or leakage is treatable with pelvic floor physical therapy in around 70 to 80% of the cases.
Oh, wow. And how long does that typically take for a treatment?
Yeah. So I'd say the initial round, if you're working one-on-one with your physical therapist, you're going to probably look at 6 weeks to get some good change.
Oh, wow. That's
which is crazy, right?
Yeah.
So there is so much research that women wait 6 years on average to actually talk to their doctor about leakage.
Yeah.
Which is kind of wild, right?
It is.
When the solution is only 6 weeks.
Yeah.
Right?
Oh, seriously.
That's nuts.
It is.
So 6 weeks will get you feeling a little bit better, not leaking as much. It may not cure you, may not fix you. You need more longer term, because we have to get your core stronger, your hips stronger. The rest of your body also has to support your pelvic floor.
Yeah. I didn't think that it was all tied together like how you mentioned. That's interesting.
Yeah.
So can a weak pelvic floor impact sexual function and enjoyment? And if so, how?
Yeah, it definitely can. So I want you to think about what an orgasm is, right? An orgasm is a series of rhythmic contractions of your pelvic floor muscles. So if your muscles can't contract because they are too weak, it's going to be very hard to achieve an orgasm, because you're not going to have the actual endurance and strength and power to do it.
Wow.
Isn't that crazy?
So can having a lot of orgasms help your pelvic floor?
So it can make your pelvic floor stronger.
For sure.
Right? If your pelvic floor is already on the tighter end, doing a lot of orgasming could continue to make it a little bit tighter.
Okay.
But it just depends. Like, right? We have to like really look at the person as a whole.
Yeah.
Right.
Like, is there actual dysfunction here? Because everything is always not black and white.
Yeah.
Right? It's always nuanced, where you're like, okay, you could be way too tight, but you could be way too weak. And you're going to be somewhere in the middle.
Okay.
So I think the other part, it's so enjoyment, definitely, if you can get your pelvic floor stronger. But if your pelvic floor is too tight, then we're going to have issues with like pain with insertion, maybe pain with orgasm, things like that.
Oh, that's sad.
So it can go both ways.
Yeah.
What kind of exercises or therapies really work for women who want to strengthen their pelvic floor?
Yeah.
What do
So
you suggest for that?
pelvic floor physical therapy
Right.
is like that's the poster child here. But we need to strengthen your pelvic floor, which could be Kegels, but honestly, it needs to transition out of Kegels very quickly.
Okay.
Because if you think about it, the last time that you sneezed and peed your pants, were you laying on your back?
No, standing.
Absolutely, right? You were standing, or when you were, running or jumping or chasing a toddler, or, any of those things. We don't live our life on our back, or we shouldn't. So we need to do pelvic floor training in functional ways, right?
It makes so much sense.
Yeah.
So pretty much all strength training, when done well, can strengthen your pelvic floor,
Right.
which is really cool.
Yeah.
Yeah.
I never put that together.
What is a normal physical therapy? Like, walk me through a session. Like, if you were to.
Absolutely.
do it.
So let's say we already evaluated your pelvic floor. We figured out that there was some weakness there, and then maybe your hips were really not that strong.
Right.
Okay, we'll say like your glutes weren't really doing their job. So if we knew all that, the first part of the session would probably be in a private treatment room, doors closed, and we would do some internal work. So the internal work would most likely be some type of combining a Kegel with a glute bridge, or combining a Kegel with some like ball squeezes, or something with a kettlebell, like in the room, just making sure you have the patterns down. Once we know that you can coordinate it and you can get your pelvic floor to work with your glutes, pelvic floor to work with your core, then we're like, great, let's move on. Then we go to the gym. Okay, so then we go into our gym, and maybe we get out some kettlebells and we're working on some hip hinging, like some deadlift movements, or we are working on some plank movements. Maybe we get out a barbell. We're really trying to get you stronger in those moments.
That is so great. Like, that is so awesome. I just never put all that together.
Yeah.
The compound pelvic floor movement.
Absolutely. Yeah. All strengthening things can be a pelvic floor exercise.
Yeah.
Again, if you're doing your pelvic floor movement and contraction correctly. So that's kind of like baseline requisite. We got to get you doing that well. Once we achieve that, totally, let's progress you as much as your body will handle.
Is there anything that you don't recommend?
So I don't recommend any of those like Kegel chairs.
I've never heard of that.
Well, that's great. So there are some medical offices that have these chairs that you sit on, and it's basically like an electrostimulation device that you sit on, and it forces you to contract not just your pelvic floor muscles, but all of your glutes, all of your adductors, all the muscles in your lower half. And the problem is it's like, oh, we'll let you do 10,000 Kegels in 30 seconds.
Oh my goodness.
That's not really that helpful, right? Those numbers may not be accurate. Like, don't quote me on those. But the problem is we already talked about, right? 50% of women don't need Kegels.
Yeah.
However, these doctors will say like, oh, this is the magic thing for everybody. Go sit on this chair. that's like part of our patients that come in to see us because they failed that treatment when in fact it actually made them worse.
Yeah.
So I definitely don't recommend that without an assessment. Some women, great. If you're so weak that you needed a machine to make you contract, sure. Can we do that for a little bit and then move on? Because do we live sitting on a chair?
No.
Absolutely not.
Oh, wow.
So if you're a doctor, let's say like my PCM, and doesn't have specialized education in pelvic floor, it's probably not the person I want to go to.
So they should be able to screen you. So there are questionnaires. So basically, if somebody says they have tailbone pain,
right,
they have constipation, hemorrhoids, if they're leaking at all, they have pain with speculums, any of that stuff, if any of that's coming up, or they feel like there's a bulge or pressure down there, that should be an automatic, great. Like, let's get you to a specialist. Yeah. Let's get you to a pelvic floor therapist. It's unlikely you need to go see urogynecology yet. It's unlikely you need to see urologist yet. Mm-hmm. Those doctors are just going to refer you back to us anyway. So just save yourself some time because they're not going to do a surgery on you, at least good ones shouldn't, until you've done a good round of pelvic floor therapy.
Yeah.
Wow.
Mm-hmm. Yeah. And you talked about some insurances you don't have to get a referral to you.
Correct.
But if you do have to get a referral, how should you have that conversation with your doctor?
So I would say just come prepared for the conversation and be really direct with your provider. Don't say like, oh, well, it's not that much when it really is. Like because if you think about it, like if you're peeing your pants, what's the emotional impact of that on you?
Yeah. It's horrible.
Right?
Yeah.
People come to our office in tears because they're embarrassed, because they've started limiting their social activities, because they don't want to accidentally leak around their girlfriends at wine night, right? When they're laughing. People that stopped participating in sports altogether or fitness as a woman. And like, that's an issue. Yeah. So these people, they feel all these emotions, but then they'll just tell their doctor, like, it's no big deal because nobody talks about it. I would say the best advice that I would have for somebody is, honestly, whenever you go to talk to your doctor about anything, is bring a 3x5 card or a sticky note and have your questions specifically listed out on it.
Such a good idea.
Right? Write it out. Say, this is my symptom. Right. This is how it's impacting me. Can I get a referral for pelvic floor physical therapy? Just make it very clear. Because the cool thing is, like, even I've done this before, is at the end of my session, I've even given that to my provider and said, like, here you go. Can you, like, I need this stuff done.
Yeah.
Because sometimes they're so rushed. You can just start with that and be like, this is what I really need.
Yeah.
Because there's no reason, I can't think of a reason that a doctor should gatekeep pelvic floor physical therapy. There's literally nothing, like, that I can think of. Besides maybe you're on bed rest. But then there are acute care pelvic floor physical therapists too. So they can come in and help too.
Wow.
So
you wouldn't put an age limit on it? Do you have older women as well?
Yes. I think our oldest patient that we've ever seen was 97.
Oh, wow.
Oh, yeah. Good for her.
I know.
Yes.
I'm glad she's getting seen.
Yes.
Yeah.
Pelvic floor therapy, we don't personally treat pediatrics, but there's at least one great therapist here in San Antonio that does treat pediatric pelvic. So think like potty training issues, constipation issues in kids, all those kind of things, totally treatable as well.
Oh, wow.
That's awesome.
So pelvic health is all ages, all genders, everybody.
Yeah, I really thought it was just women, honestly.
That's what most people think, because that's all it's talked about. Yeah. And then most people also think it's just women who were pregnant.
Yes.
Right?
Exactly.
So we get this tiny little window of people when that's just like not true.
Yeah.
Yeah, I was referred to a pelvic floor at my doctor, and everyone in that class with me, because you have to go through a pre-class, was all pregnant women.
Oh, wow.
I think I was the only one that maybe wasn't pregnant.
Right. And that's the unfortunate part, because especially, so I remember when I was in the military, there was very little resources for pelvic floor therapy. I think there was at the, here in San Antonio, I think we have 2 therapists total in the military that treat pelvic health. And with that, that's not a lot.
Not
so
at all.
That, so they need to use like group classes and more generalized education stuff just to help reach the masses.
Yeah.
But that doesn't always help everybody, because cookie cutter doesn't work.
Right.
Everybody's different, and everyone needs that one-on-one attention.
Yeah. We talked about this a little bit, but physical therapy to reverse incontinence or prolapse symptoms. Yes, you must do it. Does it help everybody?
nothing is ever everybody.
Yeah.
Right? Yeah. Nothing is ever always. If someone's talking in absolutes, like they're trying to sell you something.
Right.
Okay.
Yeah,
like,
so true.
Pelvic floor physical therapy for prolapse, for incontinence should always be the first step no matter what. There are a subset of individuals that may need a surgery. Okay. Especially if it's a higher grade or worse prolapse. Like if organs are all the way out, that's a surgery, right?
Yeah.
Nothing that I do is going to get those to go back in there, right? However, if somebody does need a surgery at some point, the best thing that they can do for themselves is to do therapy first so that they can be as strong as possible going into the surgery.
Oh, yeah.
Right? Same thing applies for like a knee surgery. You want your quads and your hip and everything so strong when you get your ACL repaired so that you come out of it and you're already really strong.
Yeah.
Right? Then you're just dealing with this little part.
Yeah.
Yeah.
So what are some lifestyle changes like posture, breathing, or even maybe diet? How does that help?
Yeah, so I'd say diet really helps a lot because if you can increase your fiber and eat
Yeah.
enough fiber,
That always
right?
comes up.
It always comes up. Fiber is this like magical thing
It
that
is.
you don't realize is in not that many foods that you're eating on a normal basis, but you need more of.
Yeah.
So increasing fiber, increasing water intake. A lot of people are very dehydrated. A lot of people are not eating enough fiber. So if those two things can be altered or changed, like that's probably the biggest lifestyle change a lot of people can do.
Okay. That's the easy ones.
Yeah. It's pretty simple. And then I would say the other one that's really helpful is just move your body.
Yeah.
Right? That could look like 10,000 steps a day.
Yeah.
It could look like 7,000 steps a day. But move your body because mobility equals motility. So if we want our bowels to move, we have to move our body too.
Yeah.
Right?
Yeah.
Moving gives us blood flow. Okay.
Interesting.
Yeah. So I'd say those are the biggest things to work
Those
on.
are easy things to walk away with to work on.
And does
Hydration.
walking help strengthen your pelvic floor?
So yeah, absolutely. Any
walking.
movement. I mean, any movement gets your muscles to move.
Yeah, sure.
Right? Is it going to be super targeted? Probably not. But is it going to help? Absolutely.
Yeah.
Like there are some patients, especially patients who have a lot of pelvic pain, like chronic pain. Our like first piece of homework is just increasing their walking.
Oh, wow.
Because we know that movement helps so much with like everything.
Yeah.
Yeah.
Oh, that's good. What's the connection between pelvic floor and our emotional and mental well-being?
It's a great question. What I hear the most is if your pelvic floor is really impacting you, that it may make you feel embarrassed.
Yeah.
As women, especially if we're having pelvic floor issues with intimacy, it can really impact our marriages or our relationships with our partners because a lot of these women will pull away from intimacy, not even just like sexual intimacy, but just like hugs, cuddling, kissing, because they're afraid it's going to lead to the next thing.
Yeah.
Right? And that they're going to just like lead their husband on or whatever when they're not really ready for it. If somebody leaks a lot, like urine, that could definitely impact intercourse as well because they may feel really embarrassed that they're leaking during intercourse. I think one of the biggest things that it can do though is it can really impact our socialness or something along those lines where, people will actually withdraw from their community because of it.
Oh, that's devastating.
Yeah.
Mm-hmm.
Yeah. And it's sad that you have to give up things that you love to do, especially if you're an active person.
Exactly.
Just because of that.
Right? You may lose your sense of identity.
Yeah.
Right? If you always identified as this active person, this athlete, someone who does sports, and now you have this mismatch of expectations and identity, that can really cause some issues.
Yeah.
Make you feel real bummed out.
For sure.
Yeah.
Is there any other advice you'd like to give our listeners?
So I'd say, the best advice that I could give is get help.
Yeah.
And don't just push these issues to the side.
Yeah.
Because there are solutions. Pelvic floor issues, leakage, constipation, pain with intercourse are totally treatable.
Yeah.
And you don't just have to live with it. Just because your grandma lived with it doesn't mean you need to.
Yeah, it's so important to say they're treatable and they're not normal.
Exactly.
You don't have to live with it, like you said.
Yeah.
Like,
Super common, right?
Yeah.
All these things are really common, but they're just not, they're not something you have to live with.
Yeah, that's so good. And then with treatment only being possibly 6 weeks,
Absolutely.
that's great.
Yeah.
Yeah, absolutely.
Yeah, and I do believe that you have to go in there and be open-minded because it's a little invasive, so getting over that part of it.
Right. And the thing is that we do everything that we can to make it comfortable.
Right.
But there's some intimacy there,
Yeah,
right?
there
Like
is.
I'm putting a finger inside of you. Like that is strange. Luckily there's no speculum involved.
Yeah.
So there's none of that. There's none of like scoot your butt off the table.
Yeah.
There's no stirrups. Like
Right.
it just feels like a totally different environment.
Right.
But the other thing is there are so many tools that we can use that don't require internal. So if somebody feels really uncomfortable, maybe there's a history of sexual trauma. Maybe they just don't want to do that. We can do a lot of stuff externally. Like there are so many other strategies that we can use. So if getting an internal exam is the thing that's making you avoid pelvic floor therapy, it's okay. Still come to pelvic floor therapy. We have so many other strategies. You just need to tell your therapist that. Say, hey, I'm not really interested in an internal exam right now. Can we do something else? And they'll be like, absolutely. And pivot.
Yeah.
Right? And there's so much we can still do.
That's
Oh,
good.
that's great.
Yeah.
Well, thank you so much for joining us
Yeah,
today.
thanks for having
It's a very
me.
good conversation.
Yeah, I learned a lot.
Yeah.
Yeah, thank you.
Amory's really wanted someone here to talk about this topic.
For a long time.
I'm
Yes.
glad you're here.
Yes.
It was very good information. So thank you so much.
You're welcome. Thank you.